Welcome to Time Warner Cable's Local Edition. My name is Brad Pomerance. We are joined by Joe Lyons. He is a member of the Claremont City Council. In his prior life, he worked as a researcher at the City of Hope in cancer research. And as a result, sir, you have a keen interest in the Affordable Care Act, healthcare reform as we know it. So I wanted to talk to you about it since you have that expertise. California is going full bore with the adoption of the Affordable Care Act, with the exchanges, with the Medicare expansion. What can you tell us from your point of view?
Well, I think California did take the lead at the earliest possible opportunity to get everything in line. Things are coming down now to the point where in October the exchange plans will be offered to the public. By January 1st, the first wave of California residents who are eligible will be selected.
And arguably, the exchanges are meant to benefit those that do not get health care coverage from an employer.
That's good.
And so if you are self-employed or can't get it through an employer, you can work through the exchange, and the exchange acts as your employer in a sense, and they have the bargaining power to try to get you better rates. Is that fair?
That's correct. And again, it will offer subsidies to families who are income eligible and will obviously provide some care based to families in the lower.
And the key, as I understand it, sir, is that the income eligibility requirements for the exchanges are not extremely low. I mean, Medicare expansion we'll talk about in a moment, but with the exchanges, I mean, the purpose of healthcare reform is to get as many people into the system as possible.
That's correct.
I mean, if you don't, I mean, then it becomes untenable.
Yes.
Because you can't have, all sick people with insurance. Am I right? I mean, you can explain that.
And so it is a risk assessment and a distribution.
Right, that's the word.
Across all health concerns.
So let's talk about the Medicare expansion. Is that right? Medicaid expansion.
There will be that.
Medicaid. So I want to make sure we're clear on this. It's Medicaid that's being expanded. Yes. Medicare essentially stays as it is. That's health care for the elderly. Yes. Medicaid expansion is for those that have lower incomes.
That's correct.
We call it in California Medi-Cal.
Yes.
So explain the Medicaid Medi-Cal expansion.
The Medicaid Medi-Cal expansion will occur as a result of the level of poverty that will include you in the group that will receive coverage. So that by expanding or raising the level of income that qualifies for inclusion in that group, you increase the number of recipients.
So as a member of a city government, why is it important to you that individuals who may be able to access the Medi-Cal expansion, the healthcare exchanges, why is that important?
Well, by our own statistics and by the census, we have 20% of our population that will qualify at one level or another in those programs.
Is this the city of Claremont?
This is the city of Claremont.
And that's a fairly wealthy community.
It is. And in the area as a whole, some communities have upwards of 30 to 35%.
And so, presumably, even though you're not delivering health care, you're not a county government, it still impacts your city when people don't have health insurance. They're walking in with flus and colds, and so is that your motivation?
My motivation is, I think, really to get as many people in the system of receiving health care as possible. I've been the beneficiary my entire working life with insurance provision. I haven't had those worries or concerns about my own family. I think that's something I would like to see others share.
Are people, in your mind, understanding the expansions? Because I feel like there still may be some confusion.
There's a lot of confusion, and they are just now beginning to roll out those programs of education and outreach to help the communities and individuals understand what will be the impacts, what they will qualify for if they qualify for coverage. And the more important thing is that ultimately each and every one of us are going to be impacted by the Health Care Reform Act. So.
No doubt. His name is Joe Lyons. He is a member of the Claremont City Council. My name is Brad Pomerance. Thank you so much for watching Time Warner Cable's Local Edition.